Bismillahirrahmanirrahim. Assalamu alaikum. In this short video, I'm going to demonstrate how to read an MRI. So let's get started. These are three images, and these three images are very important. This is called as the mid-sagittal image. Why I'm saying this mid-sagittal? Because I can see the vertebral bodies as well as the spine's process in this view. This is mid-sagittal. If we are unable to see the spine's processes, then it will be para-sagittal image. Similarly, this is also a mid-sagittal image, and this is basically the horizontal or cross section. Now there are two approaches. We can read an MRI image from posterior to anterior or anterior to posterior. So let's start with posterior to anterior. This is the spine's process. This is also spine's process, and this is also spine's process, and this white, and this white is the epidural fat. Epidural fat is outside the dura mater. Now anterior to this is the dura mater. This black line is basically your dura mater, and anterior to this black line you can see this horse tail like appearance. This is basically the chordae equina, and this anterior white structure is the CSF, and then you have the anterior thecal sac. So posterior thecal sac, anterior thecal sac, between these the white is the CSF and the gray is your chordae equina, which is collection of nerves, and anterior to that is the posterior longitudinal ligament, which is in blend with the anterior thecal sac, and the vertebral bodies. This is vertebral body, this is vertebral body, and this is vertebral body, and in between the vertebral bodies we can see the intervertebral disc, and this disc is hydrated, so it is white, and this is a bit less hydrated, so it is less bright and white, and similarly this is more dehydrated, so then it appears as black. But there is a slight difference. We need to understand that these two images are different weights. So this is T2 and this is T1. In T2, remember, for 2 it means that two structures will be bright or white. So fat and water both will be bright on T2, and only fat will be bright in T1, because you can see this epidural fat is white or bright over here, and this is T1. The CSF is black, as well as the intervertebral discs. They don't show any fluid, and there's no brightness, so that means that this is T1 weighted image and this is T2 weighted image. And similarly we need to go to the cross section and to find out the pathology. This is very easy to understand. Just first of all find the pathology in the mid-sagittal or the parasagittal images. For example, you can see this is not normal. The disc has extruded from its vicinity, and it is compressing the posterior thecal sac, and luckily the level is, I personally think this is L4 L5, so at this level there is no spinal cord. These are just nerves, and it can just compress the nerves. So this is not a very serious concern in terms of having some serious problems, like there is no spinal cord at this level, because the spinal cord lies above, so your patient does not get into spinal cord compression, but the problem lies, or the problem will remain there for the compression of the nerves. So you need to remember this, and you need to see the level first, identify the level of the disc, and then there are some slices that are marked or that are numbered, and then you can jump to the cross section of that particular disc. So for example, let's take that this is the disc and its cross section is shown over here, and this is very interesting image to see, because this posterior extrusion of the disc is pathological, and we need to find it out. So here you can see this is these are the margins of the disc, and this is the nuclear content, and you can clearly see that the nuclear content is protruded to the side. And this is important to understand, that the MRI images is the reverse image. So this is the right side and this is the left side. So this is the left side that is being compressed. So you can see this is the thecal sac containing the spinal cord. Normally it would have been like a triangle over here, but because there is compression, you can see this black portion is compressing this region. Otherwise this would be like this white all the way. So This is very important for us to understand and remember. So let me draw and tell you how normal it would look like. Okay, so I have just opened the same image into the paint, and let me draw it for you guys. So please pay attention. Let's make it white. That's a different color, so let's choose the color and click white. And now normally it would be like this, okay, if the disc would not be compressing it. And from this spinal cord, or from this thecal sac, you can see this thin line. Let me draw it a bit less thin. If you can see this right line, and this is the left side and this is the right side, so these lines, then these are telling us about the exiting nerves. So there is compression on the mid and onto the left side, and let me explain you the zones now. So we have come back to the original image, and see, this is the exiting nerve root on the right side, and there is the compression of the nerve on the left side. So this is central and paracentral plus far lateral protrusion of the disc, and this is not good. The prognosis in this particular case will be poor. Of course, it depends on the type of therapy and the patient's compliance and so many other things, but we have to understand that this is very important, and this is how we read the MRI image. And if you have any question, do let me know. Thank you very much.